Welcome and thanks for joining us today. I'm talking today with attorney Martin Crump with the law firm Davis & Crump. And we're going to talk about a product that's commonly used in surgeries across the country, but you may not know very much about. So Martin, what is the Bair Hugger Warming Device?
The Bair Hugger forced air warming device is a product that is used to heat air and to blow it around the patient. Basically, you're looking at a blower on the floor of the operating room with a tube running up to what appears to be a pool float that's wrapped around the patient, that this heated air rises up the tube, goes into the pool float, and then permeates and supposedly regulates the temperature of the patient during a surgical procedure.
That's interesting. How did these devices come to be used in surgery?
Well, it's an interesting story behind that. There was a little-known study that came out back in the late 80s that actually noted that patients do better. It was examining the limited subset of pubic surgeries for women, but that patients do better when they have heated air or maintain normothermia, which is actually a term utilized and generated or coined by the study that prevents complications within surgery. So what eventually happened is the manufacturers of these products took off on that limited subset, extrapolated the data to say that, well, if it works good in those surgeries, it would work good in all surgeries. So eventually it catches on. There's actually a Medicare amendment that is passed that says that any surgery that has the potential to go over 2 hours must have one of these devices, or the facility will potentially lose their ability to get paid. So through that manner, they became very popular. I think in 2012, for example, they were used in 22 million studies.
So Martin, just how common is the use of these devices?
Well, the estimates are, just take a given year, for example, 2012, that the device was utilized in 22 million surgeries. And that is essentially, by all estimates, 80% of this market is covered by 3M and this Bair Hugger forced air warming.
Now I understand that there's an increased risk for infection because of the use of this device. How is that?
Well, it's all based on thermodynamics. The principle of the air, a unidirectional airflow occurring within a surgery to actually have this upward movement, where the reason why, for example, they would keep a surgical room cold is that everything would be forced down. So you have your, from a microbial standpoint, you would have your germs, bugs, everything being pushed to the floor. But when you introduce this device, you have a reverse of that airflow. And not only do you have a reverse of that airflow, but you have a reverse of that airflow that is going up into this plastic blanket around the patient with this heated air. So you're actually potentially, in these cases, blowing bacteria, microbes, or bugs, as they're commonly known in the medical field, into the surgical area. The heat that is utilized in this to maintain this normal body temperature during the course of surgery actually plays a part in that as well, because of course hot air rises. And so that as that hot air rises, since the unit is on the floor, it makes it even worse, because now it's circulating all of the area at the bottom of the operating room with all of these microbes and germs, and then pulling them up and forcing them around and into the surgical field.
Wow, that's incredible information. So 3M is the manufacturer of this product. Is 3M aware of these problems?
Actually, they are through the inventor, or the co-inventor of this product, Dr. Scott Augustine. 20 years ago, after the invention of this product, began to study it more and more as it was being utilized. And in 2010, Dr. Augustine, again, the co-inventor of the product, began speaking out against the product to medical professionals and and doctors, hospitals, facilities that were utilizing the product due to these problems and concerns. And also in the aspect of the product itself and its design. I think Dr. Augustine actually goes forward and goes on to propose alternate products, such as one that would not affect that unilateral airflow within the operating room, that would be more along the lines of simply an electric blanket around the patient.
Yeah,
so you wouldn't get that microbial flow through the operating room.
That's a very interesting dilemma. And another question that I have about it is, let's say you're a patient, you're going into surgery. How would you even know if one of these devices is being used during your surgery?
Odds are you would not. The numbers that we talked about earlier, that if you had one of these surgeries, a knee replacement or a hip replacement or an open heart surgery, that those surgeries, if they have 80% of the market and they're selling $22 million a year for 22 million surgical procedures, then odds are that if one was used, it was a Bair Hugger device. But to know for sure, you would probably need to contact our law firm so that we could get the necessary paperwork from you to actually order the medical records and go through the risk management department or whatever department that we need to get the documentation of the use of product from, a lot of times billing. But that would probably be the only way that the patient would know if they would actually come to us relative to problems they have.
Yeah, you're going to need some help, and I guess, as you just mentioned, get a hold of Davis & Crump in order to facilitate your claim if you think you have one.
That's true. We would actually need to request that documentation, go through the actual injury category that the person may have. You're talking about extraordinarily serious injuries here for people who have these devices, because we're not talking about superficial skin infections that you would normally see in those types of surgeries, or that are normally warned about in surgery. You're talking about deep tissue infections, deep joint infections, and depending on what type of infection it is that has gotten into that surgical field, you may be actually talking about an infection that might not even show up until 2 years after the surgery occurred. These microbes can stay dormant in those deep tissue areas, in those deep joint infections for that long of a period of time.
That's attorney Martin Crump talking about problems with the Bair Hugger forced air warming device. And he's with the law firm of Davis & Crump. Thank you for watching.